Well, if you look at the current budget, it's gone up from 4.5 to 9.5 billion.
9.5 billion shillings?
9.5.
For the lease?
For the lease.
So this is what we're paying for the lease, and we're not using these facilities?
That's what we are going to spend. But, you know, speaking as a, you know, a nationalist, and, you know, I want to make an appeal to the national government not to reduce this very serious discussion as a fight between county governments and national governments. If there is a time that we need to see the national government being magnanimous, putting the interest of this country first than maybe what I would call egos of national government, this should be the moment. Because we have now an audit for the last 5 years. And you're having, in some counties like Kisumu, this is a new governor. He was not there in the past 5 years.
Yes.
And we need to come to the table. Really, if you have a governor who is telling you that I don't have these specialists who can handle these machines, in all honesty, why do you want to push those equipments to them and then force them to pay for listening?
Have we taken stock
really,
of this?
In a democracy like ours, what I think we need to see now is coming to a discussion, and there is a very good, I think, symbiotic relationship now between national government and the county government. At least they are talking. Really, what we need to do now is to sit on a round table and discuss as one people who belong to one nation called Kenya, and say a mistake may have happened in the past, but let's not repeat it again for another 5 years. You know, where we don't need these supplies. I don't know how that contract was signed, but can't we really say we want to pull out from this particular county and then give the equipment to as governor says, it should be on a need-by-need basis. Counties that will make use of them should be given like I know the Cuban doctors, I know for Nyamira, the specialist I'm getting is, how do you call them? The guys who deal with heart diseases, diabetes, pressure. Cardiologist. Yes. I'm getting a cardiologist. Now, if you want to give me any machine, let's mirror down to a cardiologist. Now, I don't know what specialist professor is getting in Kisumu, who was in Gishu. You know, if we have that discussion, and it should be very objective, very objective. And we say, this one, you'll get this specialist, and these are the equipment we are going to give you. Debal that way, we will be able to say that nobody has any interest in these machines. The only interest we have is to extend good Medicare to the people of this country. And, you know, even as we push these equipments, you'll be told that in other countries, these diseases you call NCDs, you know, non-communicable diseases, the investment is provision of medicine, not equipment. You know, because if somebody is suffering from cancer, I think the priority for the government is to ensure that I avail drugs to these people. If you have people with diabetes, the priority is not to extend my machines, but to ensure that they have medicines. If you go to Australia, people who are suffering from these diseases, NCDs, will walk into any pharmacy. As long as you have a prescription from a doctor, you will get those medicines over the counter, and the government will settle that bill. You know, that's what we need to do. If you go to the US, senior citizens, people above 70 years, once they go to hospital and they have a prescription, they will walk to any pharmacist, present the bill, they'll get the drugs, and the government will settle the medicine. So it should not be about pushing equipment to hospitals which are not being used. What we should be concentrating on is to ensure that we are responding to the needs of our health, needs of our people. Where they need drugs, they should get drugs. But what's the need of going to hospital? You are diagnosed with diabetes, and you will never be able to buy these medicines.
Right. Let's say from Balozi.